One of the unique features of our residency program is we call ourselves a resident-run program. And I know you oftentimes maybe hear that out there on the interview trail or through other residency programs, but I truly believe, especially as a program director, that that's one of the most important parts of my job, is listening to the residents.
The cool part about being a resident at Tulane is you get lots of autonomy. I think that's the pride and joy of Tulane. I actually really like our interns. So they come in, they know nothing. By the time they're residents, they have all the swag, right? When they're walking out the door, they feel like they can handle anything because they can, and they have. They are making decisions. That's Tulane's claim to fame. You walk in the door, you will make decisions. Now, they will be supervised, but you're gonna make the decision.
We absolutely want our residents to be ready to jump in any aspect of patient care. We want you to be competent in your procedures. We want you to feel comfortable when you leave here.
We serve all sorts of patients by working at 3 hospital systems. So at our East Jefferson Hospital, we definitely get much more of a suburban population, whereas downtown at University Medical Center, we treat much more underserved patients. And then at the VA, we of course treat veterans.
You'll do 4 weeks of inpatient or critical care consult services, spending some time in our subspecialty clinics. And then during the +1 week, it's your time dedicated towards your continuity week, your ambulatory care, where you'll build a panel of patients over 3 years in our primary care clinics, both at University Medical Center and the VA.
We run the largest network of student-run clinics in the country. So we have over 30 sites that are all run by volunteer medical students and volunteer physicians, and our residents as well, who come in to volunteer to see patients. So we see patients where they are. We see them in our shelters, we see them in substance use recovery centers, and then we see them on the street. So we operate a street medicine clinic where we'll wait and see kind of anyone who wants to see a doctor.
At Tulane, we're fortunate to have the RIGHT program, which stands for the Resident Initiative in Global Health at Tulane. And it's open to people from all specialties. It is internal medicine predominant and pediatrics predominant, but we have members from different specialties. And it's a really unique opportunity. We have faculty that work around the world. We get to do broad rotations in our 2nd and 3rd years. And so the program helps fund you to go to a location of your choice.
Tulane does a wonderful job fostering personal development in our growing physicians, in that the kinds of patients that we are responsible for caring for need a level of care that's perhaps a little higher than at other institutions. Many times we have patients that are low or reduced literacy, have really difficulty navigating a system that is now primarily online. So in fostering those relationships, I think our residents really have a sense of the empathy and patience that it takes to guide someone through their healthcare journey in their life.
You will be able to practice anywhere in the country after you do your clinical training here. I also think that community and camaraderie are large pieces of our residency program here.
My favorite aspect of the program is the importance that within our residency program that I feel is placed on EDI. When I look at my class and the 2 classes below mine, there are so many cultures and backgrounds represented. I feel like it's great for us, as learners and physicians in training, to be able to work alongside people who are different than us, that can help us see different perspectives. But also I feel like it's a great thing for the city of New Orleans to see, themselves represented in us.
Living in America, especially even being an immigrant, first-generation immigrant in America, it is a melting pot. America is a melting pot. You have people from every corner of the world living in this country. And I strongly feel like in order to provide them the best care possible, you have to have a good understanding of who they are as a person, what their cultural beliefs are. So when you have that degree of diversity, I feel like you would want to train in a program that offers you exposure to that diverse set of population. And at Tulane, you get that.
While we are a large residency program accepting anywhere from 30 to 33 residents per year and a total of 100 categorical internal medicine residents, we do have the opportunity to have smaller firms or teams that allow you to break down and never get lost within a large residency program.
I really love that when we're at work, you're working with your friends. You're not You're not working with, strangers who you don't know very well. We definitely take our relationship from inpatient to outpatient. They are my support system, my colleagues. And this goes from top down. This is attendings, fellows, residents, interns, medical students.
I think our residents work hard and play hard. I've had that feeling since I was a resident here. I felt like it was a great place to come, learn, take care of people, and then you get to play because it's New Orleans. So I think this is a great city to kind of just wrap everything together. It's the best 3 years I think you could spend.
I love New Orleans for the fact that it's one of the smallest big cities in the country. You have the opportunity to go to professional football games, really to go see the Saints. You have an opportunity to go to the Pelicans games, or potentially going to a Broadway show or going to live music. There's always an opportunity here in the city of New Orleans to enjoy the community and what the city has to offer.
Really, the great thing about this city is that it really brings you in and you become a part of it, even if you aren't from this community originally. So we do expect that you're going to give back to that community that's going to give so much to you during your residency.
There's an element of legacy that I'm really proud to be part of, both in the program, in the Tulane Internal Medicine program itself, as a healthcare provider in the city of New Orleans. It's a legacy that I think is, again, unique and special to be part of.
There is a vision and goal here that healthcare can be better, and that is certainly true, I think, for everybody who really stays in the internal medicine department.
Tulane really pulls out the drive in you. You realize how much you can undergo and how much you care about your patients and what length you'll go to really give them the care that they need. I know after training here, I am ready for anything that I can be encountered in the future.